Hi guys! Welcome back to my channel, Ticcing Together. As always, the goal of this channel is to provide education about and to raise awareness as to what it's like living with Tourette syndrome. In today's video, I'm going to be reading you guys an essay that I wrote for my history class in university this past year, and it was a course dedicated to history of American medicine, and we were allowed to choose any essay topic we wanted as long as it pertained to American medicine or some kind of medical thing in American history. So I chose the history of Tourette syndrome in America. I thought if there was any chance for me in university to write about Tourette syndrome, I would take it, because as someone that lives with it, it is not often you get to really showcase something you know about already in a class. So I thought this would be a great opportunity, and I learned a lot. So I thought I'd read you guys the essay because maybe you'll learn something too. Honestly, the stuff I found was so interesting, and I think it'd be awesome to get it out there because I didn't know it before and I live with it. So yeah, just a brief disclaimer, I am Canadian and this essay focuses on Tourette syndrome in America, but there's not a lot of Canadian stuff in the history books regarding Tourette syndrome, so America it is. And yeah, let's get to the essay. While Tourette syndrome was not necessarily a major point of study in American medicine from the late 19th to 20th centuries, the understanding of the disorder as a whole changed over time, due to the belief that the original focus of Tourette syndrome in America was on the transient tics themselves. But Tourette's as a disorder was eventually understood from a neurological standpoint, which changed the view of Tourette syndrome from both a medical and social stance across America. In America, the understanding of Tourette syndrome changed drastically among different orthodox medical practitioners over the course of the late 19th century to late 20th century. Tourette syndrome, also known as Gilles de la Tourette syndrome, was first classified by French physician and neurologist Georges Gilles de la Tourette in Europe in 1885. According to current studies surrounding Gilles de la Tourette's discovery of this rare occurrence, Tourette syndrome is characterized by repetitive, stereotyped involuntary movements and vocalizations called tics. When information about Tourette syndrome came to America about a decade after this French classification, studies from American professor of nervous and mental diseases Landon Carter Gray mentioned the same tendencies that Gilles de la Tourette had mentioned back in France, which was that Tourette syndrome caused motor incoordination accompanied by echolalia and coprolalia. Gray's study from 1885 characterized the tendency of tics in Tourette syndrome, which was called tic convulsif back in 19th century France, to a new name of palmus, which he hoped was to be used across America. Palmus, according to Gray, was his own version of a Greek-derived word used by Aristotle to describe the palpitation or twitching of the heart, and was to be used in America because the word tic had meaning in the French language but was unknown to American English. Gray and other orthodox medical practitioners from the late 19th century refer to people experiencing these palmus tendencies or tics as idiots, and that these tics showed limitation of intelligence of the individuals demonstrating them, which was later proven false. In fact, an American study in 1902 surrounding tic patients seemed to show that the tic patients in question had superior intellectual abilities, and that they displayed extraordinary intelligence, which was later agreed upon by many physicians across the globe. Many Orthodox doctors and medical scholars in the early 19th century misdiagnosed Tourette syndrome or palmus as other illnesses of the time, and would instead diagnose the disorder as other ailments such as chorea, epilepsy, myotonia, hysteria, or neurasthenia. This was evident in a study by Gray that consisted of a 6-year-old boy who was experiencing motor and vocal tics and had been misdiagnosed until Gray decided that his symptoms were caused by acute palmus, or a short-lasting form of experiencing Tourette-like symptoms and tics. Gray mentions that individuals who display symptoms of Tourette syndrome or palmus have tics that consist of sudden, instantaneous, shock-like movements of lightning-like rapidity that go to make up a sudden wink or twitch of one cheek, occasionally of both, or of the brow. This demonstrates how physicians discovered that there were many different forms of tics, with Gray breaking palmus into 4 general types. These forms of palmus consisted of facial palmus, general palmus, acute palmus, and general palmus with pseudomelancholia. Facial palmus consisted of sudden movements of the face, such as blinking the eyes or scrunching up the nose, whereas general palmus encompassed full body movements and sounds such as the echolalia and coprolalia that were first described by Gilles de la Tourette in Europe. Though there was some discovery regarding Tourette syndrome in America in the late 1800s, Gray mentions that physicians were only on the threshold of this subject, and his object had simply been to call the attention of the profession to a disease hitherto little known in this country. And though Gray's term palmus never really took off in America for the classification of ticks, further studies were to be done in the 20th century regarding ticks, and there would be trials and tribulations regarding what causes of said ticks were. The general understanding of symptoms in patients with Tourette syndrome and their plausible causes were discussed in depth in America starting in the early 1900s, and these causes varied drastically among different physicians. It is important to keep in mind that the original symptoms of individuals having tics were discovered in the very beginnings of Tourette syndrome being classified as a disorder, and that these classifications started across the globe in Europe before they ever moved to America. These early findings driven by Georges Gilles de la Tourette and Jean-Martin Charcot. It is also important to note that in the years prior to Gilles de la Tourette and the findings of orthodox physicians such as Lander Carter Gray in America, that the tics experienced by sufferers of Tourette syndrome were sometimes seen as the result of possession by the devil, witchcraft, or exorcism. These preconceived ideas about tics being of supernatural nature were proven to be false in later years, but throughout history there have been many other falsely proven accusations surrounding the disorder, such as the idea that Tourette's patients are idiots and have less intellectual ability than normal folk. American physician Charles Dana writes in his textbook of nervous diseases that the disorder is best treated by isolation, tonics, and ordinary antispasmodics. And Landon Carter Gray mentions that the tics are best treated by doses of arsenic. These treatment methods, though agreed upon by both Dana and Gray in the late 19th century, were later critiqued by American doctors in the 1930s, as the overall knowledge behind what was the cause of Tourette syndrome had drastically changed, and therefore the treatment methods needed to change. Just as the ideas from European doctors had influenced the study of Tourette syndrome in America, there were many different discoveries and opinions from doctors across America in regards to what the main cause of Tourette syndrome and tics were. Kurt Bowenheim, a scholar from Berlin, brought about the idea that compulsive tics were enabled by repressed childhood sexual conflict, and some American physicians began to believe this idea of tics being caused by sexual repressive issues as well. In fact, two American scholars from Temple University, Pennsylvania, believed too that tics were an attempt to express a repressed sexual wish or idea. These researchers, Oliver Spurgeon English and Gerald H. Day Pearson, were some of the first in America to take into the consideration the findings and beliefs of Bowenheim. Other researchers believed that tics in children were like a reincarnation of their mother's own evil and aggressive impulses, which further suggests the idea of sexual repression being a leading cause of tics in individuals. It is also important to note that American medical schools in the 1930s and 1940s were still quite unfamiliar with Tourette syndrome and Gilles de la Tourette's findings, though orthodox practitioners were on the brink of discovering and studying more about the disorder. Another American practitioner, Lawrence Selling, believed that unlike the idea that Tourette syndrome and tics were caused by sexual repressive episodes and a lack of intelligence, that tics were the result of a variety of infections and that the severity of the tics was related to the persistence of the particular infection. Selling's studies regarding this matter took up the latter years of the 1920s and blended into the 1930s, and his studies showed that after something as simple as a sinus infection, a 14-year-old boy developed a variety of debilitating facial tics. These tics did disappear after his infection had cured, but eventually returned following another prolonged sinus infection. Needless to say, over the first half of the 20th century, there were many different ideas about the causes of Tourette syndrome and tics in individuals. Though Tourette syndrome was not a main focus in the grand scheme of American medicine in the 1930s to 1940s, many American doctors and scholars did have their own unique beliefs about where the disorder stemmed from and its plausible causes. The treatments for Tourette's patients in America ranged greatly over the course of the 20th century, with plenty of debate over what the most appropriate treatment method was for this disorder. In the 1950s, surgery in America was becoming more and more popular, and was even used to treat Tourette syndrome patients' tics. Lobotomies were performed on a number of Tourette syndrome patients, and though at first this procedure was seen as a cure, it was later found that the patient's general condition deteriorated after the lobotomy was performed. In 1953, 3 American psychiatrists, Leon Eisenberg, Edward Asher, and Leo Kanner, collaborated on a review essay about the current knowledge of tics for the Journal of American Psychiatry. They claimed that pharmacologic therapy, including sedatives, muscle relaxants, and tranquilizers, had been ineffective in treatment of tics. And as a result, the 3 psychiatrists concluded that the outcome of psychotherapeutic treatment for tics was uniformly poor, often resulting in insanity among patients. By 1960, there were 20,000 trained and practicing psychotherapists in the United States, but the use of this talk therapy was seen as an ineffective treatment to Tourette syndrome, as individuals who were exposed to this therapy were not cured of their tics. It was a challenge for American doctors to find a source of treatment for individuals with Tourette syndrome and tics, and there was plenty of debate amongst medical professionals regarding what the most appropriate treatment was. Moving into the mid-1960s, many individuals started to believe that Tourette syndrome was caused by organic changes within a patient's central nervous system. This brought about new kinds of ideas for treatment, as the use of certain kinds of drugs to treat Tourette syndrome was becoming more and more mainstream, as opposed to strictly psychotherapy and lobotomies. In 1966, for example, neurologist Janice R. Stevens and psychiatrist Paul H. Blakely, who worked out of the University of Oregon, found that haloperidol was an effective form of treatment for tics. Haloperidol is an antipsychotic drug which affects the dopamine receptor in the brain, and its discovery in the treatment of Tourette syndrome tics was seen as groundbreaking. Dr. Arthur K. Shapiro of New York City's Cornell University Medical College believed that he successfully treated 250 patients with haloperidol, and claimed that haloperidol was a drug that often eliminates Tourette syndrome. Dr. Shapiro was a leading researcher surrounding the topic of Tourette syndrome in America, and his work with haloperidol would later be adapted across the world for the treatment of tics and Tourette syndrome. Moving into the 1980s, there was further debate surrounding the use of antipsychotic drugs to treat Tourette syndrome. Though psychotherapy was ineffective, antipsychotic use was believed by psychotherapists to be just as ineffective as the talk therapy was. These psychotherapists proved to be extremely resistant to the claims that antipsychotic drugs were successful in the treatment of tics and Tourette syndrome. With all of the debate surrounding the most effective treatment for Tourette syndrome in America, it is reasonable that there wasn't one surefire way of managing tics discovered in the late 20th century. And still to present-day American society, there is not one be-all, end-all to helping tics. The Tourette Syndrome Association of America was founded in 1972 by Dr. Arthur Shapiro, the same doctor who believed he had found a solution to tics in haloperidol. This was a big step in providing resources to families across America dealing with tics and Tourette syndrome, and became crucial to supporting patients with Tourette syndrome. In fact, the implementation of the association allowed for more research to be done and provided the medical world with knowledge that Tourette syndrome was indeed a neurological disorder, later reducing stigma that so many people with Tourette syndrome face. Tourette syndrome as a disorder has proven over the last 2 centuries in America to be an interesting point of research for doctors and other orthodox medical practitioners, and many different ideas about the disorder have been proven as well as disproven over time. It is important to note that in the 1890s, that Tourette syndrome was just becoming introduced to the medical world, and that it would take almost 100 years for Tourette syndrome to be recognized as a neurological disorder, as opposed to being seen as just about the transient tics or paleness. Over this time, American doctors became so much more knowledgeable about Tourette syndrome as a disorder, and this allowed for patients with Tourette syndrome to feel less like they were outcasts and more into understanding that they had a neurological disorder. As an individual with Tourette syndrome myself, it makes me feel beyond happy that this research was done in the United States over the course of the late 19th to late 20th century, because now in 21st century Canada, I can live life as an almost tic-free life, and I feel as close to normal as I can be. I believe that the research done by doctors like Landon Carter Gray and Dr. Arthur K. Shapiro has provided individuals with Tourette syndrome the ability to live amongst society, not feeling like they have to constantly hide their tics, especially without people thinking that Tourette syndrome patients are possessed by the devil or dealing with repressed sexual conflict. Because Tourette syndrome was found to be neurological and could be treated by medication, it has made the lives of so many people with Tourette syndrome a lot easier, and for that, I believe the research done in America was crucial to the development of treatment for Tourette's and tics, and crucial in changing the understanding of what Tourette syndrome as a disorder was. Over the course of American history, many individuals have dealt with motor and vocal tics, ultimately being diagnosed with Tourette syndrome. Although Tourette syndrome wasn't a major focus in healthcare in the history of American medicine, it is important important that there was research done surrounding tics and Tourette syndrome over the past 200 years, as the complete understanding of Tourette syndrome as a disorder has changed and shaped drastically over time. The fact that Tourette syndrome was understood to be a neurological disorder allowed for doctors to treat the tics in patients a lot more effectively, and as a result, patients faced less of a social stigma surrounding their tics. With the implementation of the Tourette Syndrome Association of America, families and patients with Tourette syndrome were able to get the treatment they needed, which would have otherwise been impossible prior to all the research done by American doctors. Overall, American medicine has changed the understanding of tics and Tourette syndrome as a disorder, which has provided individuals with tics and Tourette's to live their lives normally among all of society, which was not possible over 200 years ago. If you stayed to the end of this video, wow, thank you. I know it was kind of long, but this research that I did genuinely was so interesting, and I thought I would love to share it with you all because I don't think it's that well known, honestly, the history of Tourette syndrome across America. I don't think it is, so I'm sharing it with you all. I'm leaving the links to the bibliography in my description so I don't get caught for plagiarism, because this has all been done by research that I found in different books, in different articles, all sorts of stuff like that, and I compiled it into one essay that I think does a good job. I know I've been rambling for a super long time, so I'm gonna end the video here. Thank you if you watched the whole thing, because I think it helps you guys learn a lot, and the goal of my channel is to provide education, to raise awareness, and to break the stigma surrounding Tourette syndrome. And I think that this essay does a good job. If you want to help me with breaking the stigma, I would love it if you would subscribe to my channel, because like I said, with your help, you guys can help break the stigma and just learn, because Tourette syndrome isn't talked about as much as it should be, and it would be awesome if you guys could just come along on my journey. If you learned anything at all in this video, I would also love it if you would give it a thumbs up, because I did a lot of heckin' research on this and it took me weeks to do this essay. I never got the mark back for it, but hopefully I did okay. And leave a comment down below letting me know what the most interesting fact to you was, or saying hi, because I love hearing from you guys. Thank you for watching and have a great night.